Well, good evening, everyone, and welcome to today's WriteWell presentation. So it's called Dissertation, a Journey, Not a Goal. So we'll be focusing on some of our top tips and tools for writing and some resources that has helped us through our dissertation writing process. So before we dive in, I wanted to talk about what WriteWell is, and I also wanted to introduce ourselves. So my name is Charanya, one of the co-chairs of WriteWell, and I'm a third-year doctoral candidate at George Washington University. I'm working on my dissertation, and my topic is in nutrition, and I'll pass the virtual floor to my co-chair, Aubrey.
Hey y'all, my name is Aubrey. I am co-chair of WriteWell as well. I am in my fourth year and hopefully my final 8 to 9 months of my dissertation at Georgia Southern University. I am looking at LGBTQ stress, barriers to mental health care, and community support through a primary research study right now. So I am going to let Charanya take away and we'll get started. So drop any questions you've got in the chat. We will answer them as we go or at the end. Thanks, guys.
Perfect. Okay, so now I'll go over what WriteWell is. And so the reason why we started WriteWell, it was inspired by advice from one of my professors who told me that I really needed to get in the habit of writing every day and writing a lot. And to be honest, writing is not my favorite thing. Even in undergrad, I found creative ways to get out of writing. Like, for example, I joined Army ROTC as a way to get out of taking traditional writing distribution credits. But that didn't work. And then I realized I needed to write this dissertation. And I realized that the dissertation will just be the beginning of writing. And that's why we say that it's a journey and not the goal. In my mind, for whatever reason, I thought once I get through the dissertation, I'll never have to write again. But I recently realized that I'll be needing to write a lot. And if you want to make a change in the world, which we all want to do as public health professionals, that means we want to be thought leaders. So that means we want to be writing, and it could be, of course, our dissertation, but it could also be like op-eds, writing even blog posts or papers, grant applications. So WriteWell is a virtual writing group and is designed for us DrPH practitioners, and it provides a supportive and accountable space for anyone who's writing their dissertations, to op-eds, to policy briefs, grant applications, and essays. So we have monthly speaker events every third Thursday from 6 to 7 p.m. Eastern. And we feature researchers in public health who will share tips and insights to enhance our writing and research skills. We also have a community on Discord to help us keep accountable. So we'll share our goals and our writing progress. We also share resources, memes, and discussions on current public health topics so that we can build some connections. So I want to get to know you guys a little bit and some of the exciting projects that you're working on. So please introduce yourselves in the chat. Tell us what you're working on currently. What are some of your favorite writing resources that you use, and what do you hope to learn today? So I'll give you guys a couple minutes to write in the chat. Perfect. Well, welcome, Andrea. Yeah, I totally get that. Working on the dissertation proposals, that's kind of where I'm at too. So we'll definitely be discussing some of my favorite resources, and I think that will be helpful for you too. Nice. So lots of dissertation proposals. Oh, very good. Okay, so some pre-planning process, proposals. Zotero. Okay, I need to learn how to use that one. I've been hearing a lot about the Zotero dissertations. Yes. Very fun. Okay, cool. Well, thanks for sharing. That's really cool to see where we are at. Okay, so today we'll go over the lit review resources, the ones that I've been finding really helpful. And then Aubrey's going to go over some of the data analysis resources that that they've been finding helpful as well. And then we'll do a wrap up and a Q&A. So the lit reviews help us to understand the current state of knowledge, identify gaps, and to set the stage for new research. And these are some of my favorite resources here. Before, I was just told to write a lit review, and it was just so overwhelming. I would have like 1,000 tabs open on my internet browsers with no structure, and I just didn't know where to start. But I stumbled upon these books and even this YouTube video that really helped to outline what the steps are that we will need to take to write a lit review. The research design is really cool. It has a chapter just dedicated to writing the lit review portion. Writing a proposal for your dissertation is really amazing. So I think some of you have written that you're just kind of in the pre-planning phase. I would really recommend that because that even goes into how to select your topic. So mixed methods research, that book I found really helpful because mine is in mixed methods, but I think for anyone, the author Criswell is really good at just outlining what you need to do in order to get it through this process. And the last one is a YouTube video I found really helpful. And yeah, that one just goes step 1, step 2, step 3 on how to write it. And it just made it seem so much easier and less daunting to me.
Hey, Professor Davis, talk like.
Okay, so so I basically summarized all of the key steps from those resources. And really there's these 6 main steps in writing a lit review. So the first step is really you begin with some broad keywords and establish a foundational framework. And then you'll refine these through an iterative searches, and that'll help to allowing emerging topics to inform the creation of an outline. So that'll be the step 1. Then step 2, you'll be locating some resources. So you'll be using some academic databases like Google Scholar, PubMed, and source at least 50 relevant sources. And then you'll be critically skimming those. And then you'll be drafting some summaries from those articles. Then from those summaries, you'll design a literature map. And then finally, you start to put together the lit review. So the first step is finding out those keywords in the initial outline. So in writing in the book that was titled like how to write your dissertation proposal, that was one of the steps I really liked from there. So you'll start with your question in mind, your research question and topic. And from there, you'll just create a list of 30 to 40 keywords. And you'll start doing that when you do like your initial search. You'll start to look at some papers and titles. And then within those papers, you'll start to see what keywords will pop up. And you'll start to group together those keywords into themes, which will then become outline headers for your lit review. So for example, I just picked like an example topic. It's intermittent fasting on weight loss and cardiometabolic health. So I am a dietitian, and this is a question I've been getting a lot recently. A lot of my patients want to try intermittent fasting for weight loss. I don't usually recommend it, but you know, for this, I thought it'll be interesting to see what comes up. So the research question, for example, it could be like, what is the effect of time-restricted eating on weight loss and metabolic health in patients with overweight and obesity? So some example keywords from there could be intermittent fasting, weight loss, cardiovascular diseases, obesity, fasting, insulin sensitivity, and some of those metabolic markers like glucose, metabolism, lipids. So those are some examples there. And the next thing you'll do is to start to chunk those keywords together, and that will become your outline headers within your lit review. So you'll start to put together, okay, like for your introduction, you can start as really broad, talk about obesity and the health implications, and then define some of the terms like intermittent fasting. And then you'll have a section called intermittent fasting and weight loss. intermittent fasting and metabolic risk factors, and then comparative effectiveness of intermittent fasting. So those comparing the intermittent fasting to diet therapy and other eating patterns. Then the next step, you'll start to locate resources. So using those key terms, you can start to figure out what those mesh terms are. So for example, for this particular question, the mesh terms that came up were intermittent fasting or fasting and weight loss. And then you want to document what all of those searches are. So you'll just keep like a Word document and just kind of take a look at like what that search that you searched and then how many results you got. And for this particular search, there were 752 articles that came up. The next step is to just skim these articles and evaluate them. So you'll just start to create an inclusion and exclusion criteria and start to exclude the articles that don't meet your inclusion criteria. So you want to make sure that you are using a reference management tool. So I think someone mentioned the Zotero, or you can also use EndNote to keep track of all of those. And some example inclusion and exclusion criteria. So it could be, you can look at articles that were published within the last 10 years, or it could be the age group that you're looking at. It can be really making sure that the population examined had overweight and obesity. So those are some examples. The fourth step is to draft summaries or to make like a table, like the one, like the example here. So you want to make sure like when you're going through those articles, you just write a brief annotation. So that's going to include the citation, the main purpose of the work, research methods that's used, and then any key findings or conclusion, and then relevance to your research problem. So for example, this is just an example article that came up. So just wrote like what the purpose of that article was. It was just to examine the effect of a time-restricted eating on weight loss and metabolic risk factors. And then the design was a randomized controlled trial with participants randomized to consistent meal timing and time-restricted eating. And then the results are in the next column, and then the conclusions there. Then when you have done this to all of those articles that had fit your inclusion criteria, you'll start to create a literature map. So you want to look at what were those themes that popped up, and then you'll start to categorize the resources based off of those themes. So you'll just start to group them together. So the main themes, for example, for this one that might come up is weight management. So within weight management, you might see a lot of articles that discuss weight loss and body composition. And another theme could be the metabolic health improvements, such as on blood pressure, lipid profiles, and insulin sensitivity. You might find another theme within the implementation and monitoring. So looking at, well, what exactly were those eating windows? Was someone doing like a 16-hour fast versus 12-hour fast or even 24-hour fast, and the adherence to them? And then the comparative analysis with other diets. And a possible fifth theme could be just individual response variability. So maybe something that came up were like different gender differences or even age differences. And then from there, you'll just create like a little map of all of this. And with this map, you'll start to see like those major themes and sub-themes. And this is going to help you to go back to that original outline that you came up with and just to modify it with these new themes and sub-themes. And from there, you're start to assemble the lit review. So for example, for that theme, the weight management, all you do is just go in and then look at what are those articles that discuss weight management and just write a couple, like draft a couple sentences and just summarize what those articles did. And you're start to put it together like that. So this is just to go over like the main steps to write a lit review draft. But I feel like looking at these steps, it's like, okay, this isn't so bad because, you know, you're coming and you're like looking at what articles are there. You're looking at the main themes and then you're just chunking them together and just dropping in some information from each one of those articles that you're sorting through. So now I'll talk about those resources and tools that can help you along during these 6 steps. So let's say that you are coming up with a research question. So I think some of you are in that pre-planning phase or even just like looking for a topic. So these are some prompts that you can ask ChatGPT. So for example, if you're looking for a research question, like you have your topic, you can say like, help me find a research question on an example topic. And then on your research question, you can ask it to create a list of keywords for the question above. And that's going to help you to search like for your articles when you're looking on PubMed or Google Scholar. And then you can also ask it to write an outline for a lit review. So you can have it come up with like an example like themes and sub-themes for the lit review topic. And then when you're drafting summaries, you can actually maybe even like copy and paste like a section from the article if you find it really confusing, and you can ask the ChatGPT to explain it to you like you're 5. I found that really helpful, especially if there are some articles that have really confusing methodology or something. I can have it kind of explain it in a more simpler way, so that it helps to sift through the article and helps you to draft the summaries a little bit better. So we can try this. I'll show an example. All right, so let's do, if we're back on the topic of intermittent fasting, we can write, help me find a research question on intermittent fasting and weight loss. So that you can see some questions come up. So like, for example, one question says, how does intermittent fasting impact weight loss and muscle mass retention compared to traditional calorie restriction in adults aged 30 to 50? So you can see some of these questions look pretty good. And then you can also ask it to create a list of keywords for the question above. So you can see that intermittent fasting comes up, weight loss, calorie restriction, adults. So some of these can be pretty useful when you are searching for those terms. I will say ChatGPT is not really good at coming up with mesh terms. It will make up some of its own terms. So definitely don't use it to make up the mesh terms, but coming up with keywords on what you can search, I feel like it is pretty useful. And then the last thing I want to show is creating the outlines. I think that's typically the hardest part. So usually I just want like a starting point, right? So let's see, write an outline for a lit review with a structure and potential themes for the above research question. Well, I'll pick one. So you can see how it comes up with what you want to put in your introduction. And a lot of the key tips I've heard is to start really broad. So you'll just kind of do an overview of these topics, go over the methodology of your lit review, and then some of the main themes that you might come across when you are going through those articles. So I think it's just a really good starting point. And then what you can do is just save this to a Word document, and at least it gives you a starting spot. You'll be coming back and editing the outline quite a bit, like as you're going through your articles, but at least it has something to work with. Okay, and another thing I wanted to show with the chat GPT is like when you are reading through some of the articles and you come across like a paragraph or something you're just kind of confused about. So you could, like copy and paste it within here and then write, explain this to me like I'm 5. And then you can kind of see how it gives really good examples of explaining some of the statistical tests. Um, I don't know. I really liked it for that. I was taking a quant class last semester, and I really like that it gives some of the examples in a more tangible way. So, for example, this is trying to explain differences between groups at baseline using independent samples t-test. So it's trying to explain what that is, and it's using an example of, imagine you and your friends are comparing who can jump the furthest. And to keep track, we use a special chart that helps us to see how everyone is doing on average. So I like that. So if you do get stuck, I think this is a really good tool to help you get through some of those papers. Okay, so I'm going to share. The next thing I want to go over is Elicit. Okay, so Elicit is something that you can use you would ask a research question, and what it does is it comes up with some papers and it summarizes those papers. So you can use the free version, or you could use the pro version, which is $12 a month. The difference is that the pro version, it allows you to export its findings onto an Excel file. So it makes it easy for you to use the information that comes with. And this is an example of what it will come up with. So let's say that you put in like your research question, and this is actually my research question is, what are the barriers and facilitators to implementing the malnutrition care process in acute care hospital settings? And what it does, it comes up with a summary of the top 8 papers. And then it also comes up with a little table. So in the table, it'll have the paper, and then it'll have an abstract summary. And you can also add other things to the table that I'll go over. For example, you can have one section on methods, another one on like the results, conclusions, like the study variables. So basically all that you need to create like your, when you're drafting your summaries or creating like an annotated bibliography, it basically does. I mean, of course, you're going to have to double check it. It can get some things wrong, but at least it kind of creates like a template for you to go off of, and I'll go over that. Okay. So let's say, so our topic is on intermittent fasting and weight loss, and you can see like what comes up here. So it has the summary of the top 8 papers, and then when you scroll down, you can see the citation, the abstract summary, and then you can add some columns here. So you can add, okay, like what methods that they use. You can also put what were their main findings. study design. You can ask it, future research, what the research gaps are. I think that can be pretty helpful when you're trying to hone in on your topic. Participant demographic characteristics. Yeah, it's pretty useful. And then if you do have like the pro version, you can export it. So you can export it to the Excel file. That's pretty useful too. So you can kind of filter through there. But I will say, like, I think it's good. I mean, of course, you'll have to go back in and review it yourself, but at least it gives you like a nice overview of some of the main papers on this when you're trying to search for papers. Okay. And another tool here is called Connected Papers. So this one's also really great for locating some resources. So when you're looking for some more papers here, and this is what that looks like on Connected Papers. Oops. So for example, you can see which papers had cited this paper and which paper this paper had cited. So you can kind of see and kind of take a look at all of these articles that come up. And sometimes when I do some of the PubMed searches, sometimes all the articles that I want don't come up, but I do find some more when I kind of go it this way. And it's kind of cool to see it like this map. And the last tool I go over is called Ryan, and this is a cloud-based tool for systematic reviews. So what you can do is when you have a search from PubMed, you can import that search. So for example, with that intermittent fasting topic, there was like 700 searches articles that came up. So what you can do is to upload it onto the Ryan, and then what you can do is to quickly filter through there. So it'll show all of the abstracts of the articles, and you can quickly decide if you're going to include it or exclude it from your lit review. Another great thing is that, let's say that you did a search on PubMed, another one on like Google Scholar, or you did multiple searches on PubMed and you wanted to import them, it'll help to remove the duplicates. So if you had a couple of the same articles come up on those searches, you can help, it has a good system to help to remove those. And it's also a collaborative platform. So if you're working with a couple other people on this, you can, there's like a chat feature. You can also invite them to help to do the inclusion and exclusion with you. So this is what that looks like. So for example, this is where, so you would create a new review. You would add information on here, like the review title, the type, and then you would be able to upload your article. So if you have that PubMed search, you will just directly, what you would do is go on to the PubMed, and then you would hit, you'll do your search, and then you'll go to send to, and it would say, oh, sorry, you go to save, you go to all results, and then the format would just be called PubMed. So that would create a file which you would go and then upload it onto the Ryan. And this is what that looks like once you have uploaded it. You would go into review data, and you look at all of references. And you can see all of the articles that pop up here. Then you would go into the screening, and this is when you would start to filter out all of those articles. So for example, my topic is on the malnutrition care process, and there was a lot of articles that came up that wasn't really about that. So I would quickly look at the title of that article, and then I'll look through the abstract and see, okay, it's not really about my topic. I'm going to go ahead and click exclude. So then that would be on the excluded list. And then you'll just go directly to the next article and keep doing the same thing and you go through the whole search. So what I like about it is that it's just a really easy way to keep track of all of this information. That's something that I had always wondered, like, how do people keep track of all of these articles? So I found that really helpful. Okay. All right, and then now about data.
All right, guys. So while Charanya is getting that back into slideshow view for us, I just want to give you one last tip about Ryan. You can add exclusion reasons for why you're excluding an article, so that when you go to do your flow chart for your actual dissertation, you have those ready for you, and it will make it easier, and you don't have to back comb through data and figure out why you excluded that. So I had to do that recently, so just give you an extra tip. Okay, so we are going to transition into where we go from here, right? So you've got your literature review, now what? So moving on, you will see that at this point, now you've got all this information, we really got to take a look at your research questions. Hopefully you have kind of developed those research questions before you do your lit review. Sometimes it doesn't work like that. Nothing is perfect. That is okay. Nothing in your dissertation project or presentation or anything you do at this point is going to be perfect. So don't really worry about that. But you are going to want to reassess your questions at this point. So does your literature review support your research question? Yes. If not, where do we go from here? So is there that gap that you were expected to find that you can still fill with what you're asking? If not, is your research question a novel analysis method, a creative approach, integrating new knowledge? Because if it is, then it's still valuable and you can still move forward with your current research questions. Okay, but you've done your review and holy crap, somebody's already done my question. It's already been researched into the ground. What do I do now? Okay, so evaluate your literature review. See if you can identify any other gaps that are there that interest you or something that needs further investigation. So for me, I currently working in LGBTQ resources. So there's been plenty of data looking at mental health, and it might be negative and all of this stuff, but it's been done 20, 30 years ago, right? Well, things have changed so much. How do I integrate new methods into my research question to update those questions and answers that are 30 years old, right? So that's an avenue you can take if you do find yourself in this issue where your question has already been answered and you don't know where to go. And unfortunately, sometimes you just gotta readjust and completely rewrite your research questions. It's okay. You still have a literature review. That's fine. But if you get through and you don't have to do anything, change anything, you should always make sure that you're re-reviewing your research questions before you move on to the next step and refining them as you go. The more information you know, the more you are going to get into your research question and understand it. That's a good question. How do you tell if your research question has been answered? If you get through your literature review and you can answer and give yourself, or more likely your dad, a 5-minute conversation on why you have the knowledge that your research question was supposed to ask, then it's been answered. So like for me, if my research question was, how much stress is the LGBTQ individual under on a daily basis? And I can say, well, we have average stress level of 1.6 times the adjusted odds ratio of their heterosexual cis peers. They are 1.7 times more likely to have PTSD. They 73% have suffered depression and anxiety symptoms. For me, that base question has been answered because I can tell you all that pretty easily. So that's when I would readjust and try to look for a new research question. So once you're comfortable with your research question, you are going to kind of jump into your methods section. So once we go to the next slide, please. We have 4 components of your research question. You've got your design and your concept model. So what kind of study you're going to be doing. We've all seen kind of what studies we are looking at and all that fun stuff. So moving on, next is going to be your concept model of your topic. This is not always done. Charanya, would you click? But a lot of times it helps you kind of map out what you're thinking of. So this is really small. If you Google a concept map, it'll give you a much better idea. They're all variable. Everything uses somebody else's idea, and it's just connecting how you think the process that you're researching works. So for me, I'm doing stressors. So this is a very small picture of a stress model, which is one of the ones that I used for my dissertation. Once you kind of get that brain map of how things are processing, then you can go into your sample and your data collection section. So how are you recruiting your people? Was it previously collected? So secondary data, is it not collected? Do you need to do it and do primary data? Is it a self-assessment? Is it a lab value? How are you getting this information? Do you have a tool that already works for what you're asking and your population? And those two are really big questions, because you can have one without having the other, and that means it might not be the best tool for you. So you have to think through those questions. So once you're done with that, and you've got all that written up in your methods and you're quite comfortable with it, then you're going to roll into your data analysis write-up. And your data analysis write-up is going to be a bit more technical. You're going to have to go into your literature review and look for your expected values, which might require an additional literature review. So for me, I had to research the tools that I'm using, the validated tools that I'm using, to make sure I could find those expected values, because my research question isn't really something that we have any data on at all. So I needed to get myself some parameter to make this judgment call on whether or not this population is more stressed or not, right? You're gonna go ahead and lay out exactly what you're going to do. So this is not an area to just be like, yes, I'm going to use descriptive analytics to analyze my sample. You're going to want to be very specific, especially if you're doing primary data collection. Your IRB is going to want extreme specific. What kind of descriptive analysis are you going to do? Are you going to be just doing means and percentiles? Are you going to be doing analytic methods? Are you going to be running regressions, making models, doing network analysis? All those things are what you really want to think through. If you want to do a regression, I highly suggest you think through how you're going to incorporate your additional covariate. Is there literature that ties to that? Are you going to use an elastic net method or some other analytical method to identify those important covariates that you need to include in your models? And then you need to know your tools really well. So for me, I'm using 3 validated tools and 1 tool that I had to create for my my survey itself, because it doesn't exist. So at that point, I did a ton of research on the tools, used that one for the expected values, but also to get an idea of the psychometrics. Is it going to work in my population? One of them was not created for my population, has never been used for my population. So I have to start from scratch. I wanted to make sure I can collect my psychometrics so I can also report on those. So those are big things. You're happy, you're good at this point. Your committee has looked at your data analysis and says, great, you've got some really good detail. We love this. However, we want you to think about your methodology limitations. It's really good to think about your limitations now at this stage, because you can think about how to potentially fix them. Okay, so biases, I'm sure we've all had bias drilled into our brains at this point, and how much we need to think about it. But if you can think about things like selection bias and try to integrate different recruitment methods, different questions, whatever it might be, mitigation methods to help reduce that, then you are going to have a better output at the end of things. Nobody's going to reduce your limitations 100%. That's not realistic in any sense of the word. You just do the best you can. And so for my study, one of the big limitations that I can't do anything about is temporality. I'm doing an anonymous self-survey via Qualtrics. So I can't make any temporal assumptions based on, did COVID cause this distress or something like that? I can just say, this is what they're telling me. It's based on a COVID scale, and they're telling me it was because COVID, but I can't make any correlations or associations at that point. That was a lot. Your methods is a huge section of your dissertation. The smoother you can get it done before you move on to the next step, the easier the rest of it's going to be, especially if you do primary data collection, which we'll touch on in a little bit. So you got to this point, your committee okays you, you're good to start. The next thing you have to do is the fun ethics of submitting your IRB. Unless you are in a very rare instance that you aren't using participants or aren't using human subjects and you don't actually have that type of data, most likely you're going to have to submit an IRB through your institution. Okay, so on the left-hand side, you'll see the types of reviews that are at Georgia Southern for me. Like I said, non-human subjects, continuing review, those kinds of things. If you're doing a scoping review or literature review, you don't really have to do an IRB for that. But if you are going in and using secondary data, God forbid primary data, you are definitely going to have to do an IRB. Secondary data, we will talk about a little bit here shortly, as well as just in general. But good things to know when you are doing your IRB is, one, if you are just doing like secondary data, so you don't have to partner with anybody, you can just do an internal IRB, right? Now, if you are somebody who is interested in working with a hospital or an organization that you currently work with, you need to also check with them to see if they need an IRB through their own board. That is quite possible. A lot of government organizations, a lot of bigger organizations will make you go through essentially their ethics board as well. So make sure you are aware of that, and you have to also know what their documentation is, because it might be slightly different. Their consents might be slightly different. You might have to merge two formattings together. So if you know it up front, it's going to help you in the long run. What you need are things like data agreements. Are you pulling data from somebody who makes you agree to use it in a responsible, ethical way? Letters of cooperation. Are you working with businesses around town to display your flyers? That's a big one. You're going to have to get all that information, what's required of them, what they're going to be doing, how long. Informed consent, obviously, make sure you follow what your institution is telling you. Most institutions have formatted informed consent, where you can just take those and put your information in. It will help save you some time and some IRB grief on the back end if you just use their formatting, because they're going to be less likely to ask for adjustments. Debriefing materials, if you are dealing with anything that is even more than slightly sensitive and can cause distress in your participant, generally check with your IRB. They will also have some ideas on how to do that. You're going to want to include all your recruitment materials, at least a script of what you're going to be writing, as well as all of your data management methods, whether that be you're going to keep it on a locked password protected folder only on your local drive, never to be accessed by Google folders ever. It's going to be de-identified, what's going to be in there, what's not, what you're collecting. If you're doing a survey, are you collecting geolocations? Are you collecting IP addresses? Anything that you could possibly think that you could trace a person with, you got to put into that data management method section and how you're going to be dealing with that to protect your participants. Big scary one. It's one of the harder ones to get through, but I promise you, you will. So once you kind of get that IRB kind of put together in your brain, you may not have submitted at this point, it'll give you a better idea of what you're looking at. And we're going to talk a little bit about secondary versus primary data collection, just to kind of get some ideas for y'all on which direction you might want to go with this, because as we all know, there's pluses and minuses to everything that we do. So secondary data is going to be large data which you don't collect personally, right? It's already been collected, it's been de-identified, so you have access to it. There's a list of pros and cons on both of these. Obviously, secondary data is going to be much faster, much cheaper. It will generally be an expedited IRB review, depending on your institution. Mine generally takes about 2 to 3 weeks for an expedited review, sometimes longer if you do it just before Christmas break. Don't do that. That was a poor decision on my part. And generally, you'll have access to larger samples. So a lot of these data sets are national data sets, global data sets that you can utilize. So you can think COVID data sets, right? Those are a lot of publicly available data sets. That's what we're talking about here. But the problem with that is going to be that, one, it's available to everybody. So you don't know who's working on what. You don't know if somebody else is already actually working on your progress or on your question. One of my cohort members was doing his on a national cancer data set, and he was about to schedule his dissertation defense, and somebody published his exact research question. So he had to scrap it and start from scratch. So that was a rough one for him. You also have to think about how the data was collected, how it was cleaned, how it was managed. Were there questions that don't actually ask what they're meaning to ask? So those are some validity things that you need to consider as well. Secondary data is really, really great for a lot of things, but depending on your research question and what you're trying to ask, it's not going to work. So for me, I'm looking for current distress, right? What's going on right now, as well as what social supports people are using currently in their community. I don't have a secondary data set for that, so I have to do primary data set, which is a whole can of worms on its own. It's great because I can design it exactly how I want, use the exact population I want, the tools I want. I have control over all the data and everything. But it is more costly, it's slower. I am self-funding my own project, and it does have some increased risks of potential adverse effects. I have to be a little bit more careful about how I'm asking questions, provide debriefing materials, make sure I am covering and keeping everybody's data as much confidentially and anonymous as possible. And depending on your population and what you're trying to research, especially as a dissertation, as a student without much funding, it can be difficult to adequately power your sample. So that's something you really need to think about in your methods section when you're putting this through. So just to give you a little idea, I was hoping to get a representative sample, and that through a sample size was going to be about 400 people. I have been running my study for almost 4 months now. I don't even have 50 participants yet. So I'm dealing with a very small, hard to reach population. That is not going to be everybody's experience, but that is something you need to consider if you are going to go the primary route. Make sure you are aware that it is going to probably take you longer. So it's okay. You will get through it. I swear, I promise. I'm going to get through it. It will be fine. So if we go on to the next tab, this is our lovely NHANES. I'm sure we have all heard about NHANES before. It's a large national US-based sample where it is the National Health and Nutrition Examination Survey. It is used very frequently in a lot of secondary data sites. There's a ton of years you can see down there and a ton of data. If you will click for me, there are a million different secondary data collections that are national level that you can access that answers a billion different questions, from behavioral risk to utilization to literally everything. So if you are interested in a question, Google it. Google large national samples, available data, secondary data, those kinds of things, and I'm sure you can probably find it. So that's a really great thing. Lastly, in the data portion, we do have primary data collection. There's a ton of ways to get primary data collection. Surveys, observations, inpatient, outpatient, oral histories, interviews, focus groups. I could list for probably 15 minutes. What you need to think about through here is the best way to get your question answered in a timely fashion that works for you and is the best for the participants as well. Because yeah, sure, I could ask for interviews with people asking about their LGBTQ stress that's caused by discrimination, and I'm sure I would get some really great answers, but that also would increase their distress, and it's just not worth it. So for me, I'm doing a survey. Like I said, there's a ton of different ways. There's mixed methods, and you can combine a lot of these. So there's a really good way to get your primary data. You just have to be creative about it. And lastly, just wanted to touch on some of the plethora of data analysis tools. I'm sure we have all used one of these. We're all going to have a favorite one. There's no one better than the other. There are some things that you can only do on specific programs. For me, I'm hoping to do a network analysis, which is something I can do on R. I would never be able to do that on SAS. So if you are starting out in your program, what I can tell you from my own experience, regardless of if you're an epidemiologist like me, a biostats person, if you're in the public health field, try to learn at least 2 programs during your time in school. It will help you immensely just to understand differences between programs and how to teach yourself how to do a program, because as many times as we have classes that try to teach us, we're not going to know it unless we do it ourselves. So the only thing I can say is don't analyze your data in Excel. Just don't do it. You can make a table and a graph in there, just analyze it through some statistical software. That was really all high level, but at this point you have gone through all of the steps, and the last step you have to do is to complete your dissertation and put it all in words, which is the hardest part in my own personal opinion. But I am going to throw it back over to Charanya to go ahead and wrap things up, and I'm going to answer some questions in chat. And if you have any questions, throw them in chat, unmute, and ask away.
Yes, so thank you for joining us. Yes, please ask us questions. Let us know what you think. We are definitely happy to share even more information. We will have our next speaker session. It will be next month on April 18th at 6 p.m. And then we have a resource center, Discord, and then you can always reach us email with questions. And I just see a couple questions in the chat. I think Aubrey might be better at answering some of these. So do you have any suggestions for international data sets?
I do not have any international data sets off the top of my head. I would say WHO is definitely a good source to start looking at to see if you can find some publicly available data sets, as well as some researchers who might be open to doing some data sharing agreements. That would be the best way I can suggest doing it. I will say, I just saw somebody ask if we can share the recording. I dropped a Google form in the chat just now. If you fill that out, we can email you slides, and we're going to try to get the recording put up on our NADrPH YouTube so that you guys can all have access to it.
I saw another question. Are there any good secondary qualitative data from those resources you just shared on the last slide? That is a good question. Qualitative data set.
Qualitative is going to be a little bit harder to obtain because it generally can be, it's easier to connect who's saying what to the person. So a lot of times qualitative data isn't going to be readily available. So that can be really hard because generally it's done through like screen recordings and Zoom recordings and things like that. You may be able to get de-identified transcripts of them or de-identified like themes of them, but I can't guarantee that, and you would probably have to talk to the researcher directly. I don't believe I've heard of like a database online, but I also have not looked for it, so I wouldn't be able to answer that. I'm sorry.
That's a good question, though. I think that's something I might want to ask one of my professors. I wonder if there is, like, even within the university, if there's any data archives or something like that. That's a good question. I think somebody had their hand up. I can't remember who it was, but yeah, let me know if you have a question.
That was me. That was Sunita. I was just wondering about the slides and the recording, and as I raised my hand, I heard answering them. I'm like, okay, hands down. Thank you guys so much for these resources. I had no idea that were available out there, and I really appreciate the fact that you use ChatGPT to demonstrate its usefulness, because I feel like in public health, like we see it more as we focus too much on the unethical aspect of it rather than embracing it as just another tool that we need to become more literate about using and teaching students and other people how to use better to to do their work. Of course, academic integrity, we have to always emphasize that, but I appreciate the fact that you've made the bold step to kind of use it and show us how we can use it in our work.
I think it's just like a brainstorming tool, because I think that's the part I get the most stuck with. And I think like if I'm in a room with other people, we'll be doing that same thing with brainstorming, but it really cannot replace you. And that's why like you as like the public health professional will be, actually putting together their information and writing it. Because if you have ChatGPT to do that, it'll be all wrong.
Exactly, because you don't want to be investing into knowledge that actually applying to yourself and becoming better at by having someone does the work for you. So it's
That's
just
exactly right.
thank you.
And then Seema, am I saying your name right? You have a question.
Sorry, Samia.
Sorry.
Yeah.
Yes, you had a question about narrowing down a dissertation topic. That is a really good
I'm
one.
having a
I
hard
had that
time.
problem too going in.
I have a lot of interest.
I can talk about how I did mine. So I'm a
Yeah.
dietitian, and my goal was to really enhance my field. So what I did was I looked at some of the journal articles, it was like the Academy of Nutrition and Dietetics, and then I also reached out to the chief science officer of the Academy of Nutrition and Dietetics and tried to discuss like some ideas with her, and that's how my topic came about. It was like through a discussion with her that helped me realize, oh yeah, this is what I'm really interested in. And that's kind of where I decided on my topic. So my topic's on the malnutrition care process in acute care hospital settings. And I chose that because it's like kind of like I saw that topic quite a bit come up in a lot of my articles that I was reading, and it seemed to be like a really big topic now, and there's just not a lot of good research on it. Like I found that there was a gap. There was not a lot of qualitative data on it. There wasn't a lot of case studies, and I thought, oh yeah, this would be a really cool topic. But it did take me a while. What are some of the ideas that you have so far?
So I was thinking of, because I work at a Department of Mental Health at the state level. So we have data in terms of diagnoses and treatment, like overall. So I was thinking either combining faith and spirituality and mental health. I'm also doing like DEI workforce, or so like organizational culture change, and seeing how like effective DEI training programs are and culture change in terms of public health practitioners. So, and then I have like interest in global international health.
Okay.
And I did like a side project during a class where I did do a very, very quick, just for practice, analysis on secondary data for a professor. So I have, 3 major interests, and I'm really struggling. I know our prospectus is due soon, like in May or so. So I'm kind of struggling figuring out what route.
I think you're in a really good spot, actually. So like with those 3 topics, what I would do is just do like a really brief review and see like find maybe like 10 articles like per those topics, and then see like what the gaps are, like what you're coming across in the research, and then see like which one is the most feasible to do within your timeline. And I think that's a really good starting point. And that one of the books I mentioned kind of discusses that in more detail, like how to write your dissertation proposal, like finding that topic. And that's exactly what I thought was really good, because I'm like, oh yeah. And I think that's a good spot to be in, especially now. And that's a lot of time between now and May. I think you can definitely like pick one, and you can do like kind of like a feasibility like trial, like in your head, be like, will this work out? So you're kind of going through those steps and seeing like what is the most doable.
Yeah, I'm starting this early because folks from last year, they're graduating, and I'm hearing people, IRB hasn't been approved. They're supposed to graduate in May. They might end up actually taking a class in the summer. I'm like, nope, I am not spending another $10,000 for a summer class just to finish my dissertation. So I'm like, the earlier, even though, our director is saying don't start this early, I'm like, no, I have to. Like, she doesn't want to freak us out and say that this is the struggles that students are having, but it's a real issue.
What is your DrPH concentration?
diverse populations and health equity. The interesting thing is the college that I'm in, this is their second year doing the program. So I'm the second year folks. So
Cool.
a lot has been trial and error on that first year.
Something you could potentially think about including, just because of how it is looking at the effect of the political landscape around DEI currently and how it's impacting marginalized and underserved populations. So if that is something that you're interested in, please run with it.
Okay, thank you. I appreciate that.
Really great topic ideas. Good.
Did anybody else have any other questions or anything like that?
Yeah, I was just gonna unmute to say thank you so much for like volunteering your time to help us. I hope that you find it like useful for you as well. I was familiar with many of the tools that you talked about.
Cool.
We have, and we have so many debates at University of Texas Health Sciences Center, UT Health, because we're all over the state and everyone has favorite everything, but yours sounded really great. Yeah, I know. It's like, doesn't really matter. Just find something that works for you, that you want to learn, that you can afford. I think I'm in a challenging spot in that we have lots of folks who absolutely are doing great things with nutrition and physical activity and chronic illness, and then fewer of us who are in the mental health and substance misuse space. So Aubrey, I'm with you. And we just don't have a lot of faculty. We have a few faculty. They tend to focus more on like medication assisted recovery and peer support for recovery, and super important, but like I'm a little more upstream. I'm really much more interested in how do communities and how do people in communities support youth? How do they support teenagers in particular who are going through so much, so that they can hopefully like have very early detection of mental health challenges, well upstream of the emergency room and psychiatric care. And like Aubrey, I'm also interested in looking at LGBTQ plus youth. I just think that there's just like we just have not scratched the surface, and the population is growing and it's becoming more diverse. And a lot of people are like, well, why don't you want to study like racial groups? And I'm like, because other people do that. Like I want to study things, I want to find that white space, that gap. So I'd love to continue to talk to you about sort of how you formulated your research questions. Like you, I am going to do at least some primary research. I'm really actually skilled at qualitative, so that may be my contribution to the group to talk about qualitative methods. I teach qualitative methods to master students.
Cool.
And yeah, my practicum is qualitative interviewing. So yeah, but I'd love just to have the ability to have just a group of people who want to get it done and are not guarded about sharing their ideas, tools, resources, or be like, Sharon, what are you thinking? Like, I don't mind that at all.
I will drop my email in the chat. Feel free to shoot me an email if anybody has like mental health stuff or questions like that, because I too ran into the issue where like I probably got the best output or I guess the best I could ever hope for with my chair. She was my GA advisor as well throughout this whole process. And she works in like the neuro field. So she's done a little bit more of the mental health, but the best thing I can tell you, if you are in a mental health and you want to do research, nobody is going to know it. in our discipline. Like
Well,
it's
they're
just
they're
happening.
starting, like they're
Yeah.
not like 20, 30, 40 years in so that we
Exactly,
can learn from
exactly.
them. They're like, oh, well, that's
Yes, exactly.
novel.
You
Okay.
have to be the expert in your dissertation committee and advocate for the mental health side of things, which is going to be hard because you're still a student. But at this point, once you start your dissertation, start thinking of yourself as a peer, and that should help. That's what's
Yeah.
helped me.
My advantage, not to disclose too much, I can go on camera, is that I'm not 25 or 35. So that's my advantage. And that I'm actually like the same age as the faculty. So
Nice.
they
That
kind
does
of,
help.
in a sense, you know, like they know I'm gonna be confident and I'm gonna speak up. And of course they can tell me I just have it way wrong, but I'm not afraid to sort of assert my ideas, and especially when they don't know the topic, they don't know the population. But yeah, I'd love to connect with you. Thank you so much for letting me just have a little chat there about everything that was going through my brain for the past hour.
No problem.
Thanks.
Yeah, thank you for sharing. It's something that well, it's funny that you say that a lot of people do the nutrition and physical activity, because I feel like where I am, I'm struggling to find researchers in that topic. So I'm kind of having the same issue over here too. But yeah, that's good advice to kind of think about yourself as the expert, and that can be a challenge. All right, well, good. Well, yeah, thanks for sharing. And then for everyone else, if you have any questions, our emails are on the slide. And yeah, make sure you fill out the survey. We want to hear your feedback. And as to keep connected. So we have a Discord, and then just keep in touch. Definitely want to hear about your dissertation progress and how everything is going. And thanks for joining.